English, translate to Arabic for
نقص الصفيحات الدموية بعد كم يحسنون
صحيح. Thank you so much. Go to the other slide, please. Asma, go ahead and change the other slide. Hand to each other to translate one step. Okay. Okay, that's enough. Mohammed Hussein. Mohammed Hussein. Abdul Hussein.
ITV, the regulated count, is used to this last month. regulated مرة في ITV regulated أقل من
Yusuf, Sama, Yusuf, is it correct?
Yes.
Okay, go change the Yusuf, the other slide. Thank you so much. And what about Asmar? Asmar, okay, Asmar, please read and translate in Arabic for Sajjad. Sajjad, absent. No, Sajjad, and the next one is biggest. Sajjad later, okay. Okay, please read and translate in Arabic for Sajjad later.
IV, immunoglobulin, IVIG, and NTZ antibody. ده الأدوية.
Okay, look at the Sajjad. Okay, and say
بس البليتلت لازم تكون
Or
أكثر
who
من
is,
300.
okay, look at her. Look at her. Communication with each other. Look at them and say to them. Okay.
إذا كان أكو bleeding or نقص قصدي نقص الفتحات الدموية أقل من 20,000 يحتاج إلى treatment. إذا كان 30,000 ما يحتاج treatment بس إذا كان 20,000 راح يحتاج treatment أو أقل من 20. splenectomy يعني chronic في استئصال الظهر إذا كان المرض مزمن. prognosis PIG it's علاج.
You find the Arabic? Go and check the slide. I will say, what, go to the next slide. It is ideal. Okay, what is this? Oh, it's okay, what is this?
Yes. Yeah.
Translating English for Walker. Yes, explain, what is this in Arabic?
هذا علاج يطرد البي اي تي بي بي اي بي اي جي اللي هي صاعد المناعه.
هي الميكانيزم هذا الدواء.
I've done it.
Explain.
I've asked him about how the
This
mechanism.
IVIG, what we have in this? What's the component of it?
It's
Do you remember Majid?
yeah. IVIG, So all of them are here? Yeah. Doctor, and then no. The blood measures now. Okay.
You asked why we use IVIG. What's your answer? Please ask question from Nasseria. Ask me. Listen well. Here.
لا ضل
Okay, you can see the ITPEs. Have a decrease in your body. Okay? And we inject you IVIG to increase immune system. Okay? That's against of your platelet. If you increase, the platelet doesn't decrease. Okay? Do you find? Can you translate to Arabic for us?
مش عارف.
ايه سويت جاي الله
Okay, Nasser, go please.
ناصريتك دكتور you could give me a block.
Plus,
Yeah.
3 plus we get it.
Thank you.
Okay.
Yusuf, please read this and translate in Arabic. Explain for Omer. 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 Okay, read it.
Parental infusion is bro habit. يعني انه ما راح انه ننقل
So for me, Omer.
ما راح ننقل صراحه
واي
Yusuf, say
because I think
I need the word Omer. Please translate to Arabic. Go, doctor. Omer and Do you have any question? Ask Omer and Yusuf.
يعني أحسن الصور.
Okay, I wanted to translate for Omer. Say what? In Arabic for what was his name? Wasn't.
السبب انه الجسم راح يصير عنده غد تحسسي
Wasn't is here. Wasn't is here.
هو حوالي.
ذا بودي ميكانيزم الجسم راح تصير عنده غد تحسسي ضد الابريز اللي متبرع ايوه
Is it correct? Sakina. Is it correct? Sakina, from where? What city? Musa. Okay, you have all in one. Yes? Very much. And what was your talent? Basketball. Okay. So, change the slide. Sakina, Musa. Are you happy? Okay, thank you so much.
What a sugar thing. Okay, in English or yes.
Okay, look at and listen to the international student, the only international student in this class. Okay, explain.
In English or in Arabic?
No, English.
English.
You are the international student.
International student pay money more?
No.
No, the same. It's a free, no money. Free. Don't pay any money. Yes. All the class.
Okay, don't worry. That's okay.
Parents are encouraged to engage their children in quiet activities and to prevent any injuries to the child's head.
Okay.
Okay. Parents are encouraged to engage their children in quiet activities and prevent injuries, head injuries, to the child's head. Wear protective headgear, hats, and other things that you wear on your head, and lining the crib bed with protective padding to prevent injury because they don't have that leg and they can't. They will bleeding a lot and
Okay, the brain is very...
Dangerous.
dangerous.
Okay, go on and change the slide, please. Activity is good for you, then absent. Okay, from yes, okay. What was your name? Leon? Leon, what's the meaning of Leon?
Follow love.
High level, okay? High level, okay. Please read this and say to me the meaning, okay? You are waiting for Leon from Lebanon. Okay, read it. Arabic and also English for special for English and Arabic for okay, don't worry. Read please.
الأنشطة عدد صفائح جمعية للطفل الأقل. نقسم يجب أن لا يكون الأطفال الذين يعانون من حالة TB مشاركة في أي رياضات التزاحم علاقات الجنسية
And what is in English?
activities while their children make it count is less than 50,000. Children with ITB should not participate in any connect support back region like reading, skating, reading and line skating.
That was
Excuse me, Sajo, I think that's the boy and his name is Sajo. Okay. Go and change the slide and also read it. Go fast, please. If you can. If you can go, please obey. I want all of you. Okay, please read on.
Children with ITB should not particle, bait in any contact sport, big reading, skatting, boarding in line, skating, gymnastics, clumping or running, wear protective headgear, and lining the crib with the protective bedding or padding.
Okay, can you explain in Arabic? No? Not Arabic?
Yeah. Yes. نتجنب الألعاب الخطرة ولازم نحمي الرأس والذن يعني حتى ما يصير أي إصابة للرأس.
Okay, please change slide.
Victor, Muhammad didn't participate for today.
Where is Muhammad?
Muhammad now.
Okay, Muhammad. Smoking, only smoking, smoker in this class, okay?
Okay.
Please read it and translate it for this code. What was the name? Hashem. Hashem from Karbala. Okay. Read it, please.
Parents are encouraged to engage their children in quiet activities and to prevent any injuries to the child's head, for example, by having the child. So بيقول إن أنا الآباء
Hashem.
يشاركون
Where is Hashem? Please look at Hashem. Translate it for Hashem. Hashem, look at the...
الأطفال الآباء يشاركون أبنائهم وأطفالهم
ما يشاركون
يشاركوهم quiet activity هذه حتى ما يدلون أطفالهم.
Okay, Mustafa. Go and please share the slide. And Hassan and read it because you are look like each other. See your similarities. Okay? Otherwise, we need to look at they are look like each other, similar to each other. Just please, okay? Unfortunately, it's new. That's Henry Schwanlein from it's about two scientists that was from Germany and their name was Henry and Schwanlein. There were two scientists that introduced this disease that is Henry Schwanlein purpura. Is the most common vasculitis. Do you know what is vasculitis?
Yes, an inflammation.
What is vasculitis? Inflammation in the vessels. Okay? And you have a child with arthralgia, purpura, renal disease, and abdominal pain. It's related to vasculitis in these parts. For example, if you have arthralgia, vasculitis happens in the joints. If you have purpura, what's happening? You have purpura also. The vessels rupture because of inflammation and you have purpura. Okay? Yes. And why we have renal disease?
because
We have vasculitis in renal led to renal disease. Sometimes you have bleeding and you have abdominal pain. Why? Vasculitis in GI, in intestine, in the abdomen. Okay? Okay. This is Henry and Schwanlein. Okay? Is it related to platelet?
No.
It is related to 13 factors? No. Let me go. Is it related to the other factors? No. Only vasculitis.
Vascular.
Everywhere of your body. If it happened, it wasn't in your brain, vasculitis, what happened? In your brain happened.
Okay.
I'll die.
Maybe
Hydrocephalus.
die. Maybe rupture of
Maybe hydrocephalus.
vessels, not hydrocephalus, die. Hydrocephaly is related to CSF. Don't miss them, okay? It is only related to vessels in your brain. Vasculitis happen, okay? And led to rupture of vessel and maybe death, hemorrhage and death. The patient comes to emergency ward in Nasiriyeh, in one of 5 Nasiriyeh. Maybe you have one of these patients. This is vasculitis. Okay? Cause large all children's disease is unknown. You didn't know. Okay? Maybe some viral infection happened. For example, your baby get a common cold. After that happened vasculitis. Maybe bite insects, and it is common in 2 to 8 years old boys. Like many of diseases related to children, boys are in danger of it more. Why?
Unknown.
Unknown. We didn't know. Why boy? We didn't know. Okay?
All of disease in your files are known.
Not all of disease. Many of disease in children are more than in boys. The cause is unknown. Okay?
Doctor, what about DDH?
DDH was about different.
Is it common in men or?
Common in men.
Many common, but incidence in different countries is different. In America,
You said in,
yes.
in the first lecture you said
Yes,
it's more
yes.
common in females.
Yes. Female
Yeah, you did.
DDH, yes, but it's not in all of countries, as I said to you. In general, something that then I said to you about incidence is in general. In European countries, maybe in some region is different.
So also this disease maybe is different from country to country, not all of them.
Yes, in the international books that we say one book for pediatric nursing, something that I said and all of pediatric nurses said is related to that international book. That's standard. Okay?
Excuse me.
But maybe your country, your city is different.
Doctor, what do you mean when you said that's because it's unknown?
We didn't know.
We don't have ability to know.
Yes, but researchers shows it's related to infection. Okay? Related to bite insects. And common in 2 to 8 years old boys. He didn't know why. This incidence in the Wound book. That's an international book, okay? If you go for Canada to America for continuing your study, Wound book is international book. And something that I say to you in this class, because you are international students, is based on international book. Pay attention. The children comes to your emergency ward as this, okay? You see raised. You can see raised means swollen. And this is vasculitis, okay? This is vasculitis in the skin that's happened. This Henuch and Schwellline.
Yeah.
Okay?
Okay.
This is raised. Compare it with ITP.
It's same to purpura.
Purpura, yes, but this purpura is raised. Okay? Not mix them with each other. Henuch Schwellline is raised by vasculitis. Skin rashes are common. Maybe you have peteshi, purpura, because of rupture of the vein. edema, inflammation of joints in knee and ankle. Why we have edema? Why we have purpura? Because of vasculitis and bleeding led to purpura and petechiae sometimes. Okay? Why we have petechiae and purpura? Because of rupture of vasculitis. Why we have rushes? Because of vasculitis. Pay attention. We have inflammation in knee and ankle too. Maybe you have vasculitis in stomach. Maybe you have vasculitis in intestine. Maybe in the brain. That is very, very serious disease. The children comes to emergency with this pattern, that is by vasculitis. These are raised. For confirming, you can get a biopsy and send it to laboratory for confirming. Okay? They have pain. Why? What do you think about their pain?
From the swelling?
Yes, pain.
Because the intestines
Because of vasculitis. Vasculitis in the head led to pain, headache in the stomach, and bleeding in intestine and bleeding in stool. Why? Why bleeding? Vasculitis and rupture. Rupture of the vessels led to bleeding. That is very, very important. And kidney problems. What do you think about kidney problems? Why the cause? What the cause? Vasculitis in kidney vessels and rupture of kidney vessels led to bleeding. Protein in urine, glomerulonephritis, and kidney failure. Maybe led to kidney failure. Why? Vasculitis. The disease is self-limited. Pay attention. ITP and the Henoch-Schönlein are diseases that they are self-limited. Self-limited means
You can't get someone infected.
no.
It's a
Cure by itself. Cure, self-limited, cure by itself.
Self-cure.
But they are serious. Why?
because if it's a complication, it can lead to death.
Bleeding and led to death.
Yeah, if
You have bleeding in the brain, in Henoch-Schönlein because of vasculitis, in ITP because of decreasing platelet. All of them led to bleeding. Good prognosis. Don't worry, that's a good disease. Self-limited and good prognosis. Sometimes led to complication and death. Then you have bleeding in the brain. Pay attention.
Doctor, this disease causes the sepsis or no?
Do you agree why we have sepsis in these patients?
Yes.
Why?
Because the inflammation in the vessels.
Yeah.
So it could be
Pay attention.
transmitted.
Henoch-Schönlein and ITP are acute. Acute happen. And sepsis is in a long term. If you admitted them in the hospital, maybe led to sepsis. But in acute, no. In acute, no. Okay? Diagnosis is clinical, and for confirming, get a biopsy of the skin and send it to laboratory and confirm that is Henoch-Schönlein or the other skin rashes. Okay? This is diagnosis. What do you think about treatment? Self-limited. Why? Pay attention. We said maybe you have vasculitis in brain, hemorrhage. We couldn't wait up to self-limited. Pay attention. You should do treatment Many of these patients have 2 weeks ago infectious disease, for example, common cold, okay? Or the other herpes simplex, helicobacter, or the other infection. But something that is common cold. I said about abdominal pain, okay? And subcutaneous bleeding, blood in urine, that's related to complication of disease and require treatment. In very rare cases, it causes kidney failure, as I said to you, because of vasculitis. Sometimes we have intestinal perforation. Why? Intestinal perforation.
Due to them?
Why? Intestinal rupture. Because of vasculitis. The vasculature in the stomach, in the intestine, inflamed and ruptured and led to bleeding. Okay? As I said to you, upper respiratory tract infection is responsible for it. I will speak with you in the next session about intussusception, maybe happened in them. I will introduce intussusception for you. And something that is very, very important is involvement central nervous system. Brain is very important. Kidney is very important. And bad prognosis. You know, in kidney led to failure, and in the brain led to IVH or bleeding. Renal involvement is usually benign, and maybe nephrotic syndrome, kidney failure happened and led to kidney failure.
It can lead to meningitis in the brain.
Do you agree meningitis is related to infection? This is acute. In acute, pay attention. Only bleeding is important in the brain. In chronic, if you admitted them, maybe in the future get meningitis, but not in acute form. In acute form, we have pain and bleeding. We have nephritis in the kidney because of Henoch-Schwann, because of vasculitis. It's and treatment. Some researchers showed that it's related to immune system. Because of it, we use a steroid, cortisone, you know, corticosteroid, and also IVIG. Why we use IVIG? Because researchers showed that it's related to decreased immune system. And with IVIG, you try to increase immune system. Okay? IVIG we use and steroid. Which one is the first, which one in the last? It's related to doctor's decision. But at the first we use steroid. Treatment of this disease is symptomatic and depends on the symptoms, because more than 90% of patients, especially children, have a self-limiting disease. Pay attention. If the patient, for example, a children comes with headache, is it good that we wait for self-limited? No. We start IVIG and steroid as soon as possible. Okay? And the pain control, hydration, soft diet, reducing activity. Pay attention. Also for Henoch is necessary because of IVH. Pay attention. Immobilized children and stop activity, pay attention to them, and the treatment is steroid and IVIG. Okay. Who wants to compare ITP and Henoch with me?
Give him a plus.
Compare them. Okay. Compare ITP and Henoch with each other.
I start with the ITV.
Only compare them with each other. Compare.
ITV is autoimmune system.
ITP is related to immune system and Henoch also.
Unknown because the infection and bacteria they found.
Okay, both of them is related to viral infection.
Yes.
Okay, and
ITIM it's happen in the blood plate, okay, but the veno and Henoch, sorry, it's in the vessels, okay.
okay, in ITP you have decreasing platelet, in Henoch you have vasculitis. Okay?
Also, the
symptom of Henoch is
for ITP, purpura, bleeding may be suspected to bleeding.
petechia, maybe epistaxis. In Henoch,
and the another one, if it's pain and swelling,
compare them. Compare them.
And purpura,
Okay.
petechia also, and in severe cases, renal disease and hemorrhage.
We have renal failure in ITP or no?
No.
Why? Why we didn't have
Because it has nothing to do with the inflammation of vessels.
vessels? Okay, this is related to vasculitis. Okay.
In Henoch we have it's caused by vasculitis, while ITB is caused by the low of the blood levels.
Okay.
Also the treatment.
Okay.
For idiopathic purpura is IVIG or prednisolone.
Okay.
For the another one, this one steroid and IVIG.
Okay. Is it possible that we inject platelet to Henoch?
No. Yes.
To Henoch platelet.
Normal platelet.
Yes.
Yes, because it's not autoimmune disease.
Henoch platelet.
Normal.
Why?
It's not even.
I'm a Henoch Schwellen child.
If he has
I only have vasculitis and my platelet is normal.
If
Why
the
you
blood
inject
plate-
me?
the blood plate is normal, he has normal, we don't give it blood plate, but it was decreased down.
Platelet is not acceptable for Henoch Schwellen and also for ITP, I said. Why?
I mean, if the vasculitis happen and the patient have decreased the blood plate, we can.
Okay, in the normal
But
form
if the
of
normal
Henoch,
blood plate,
we
we
didn't
don't.
have any
Yeah.
platelet decrease.
Yeah.
Okay?
ITV should be
In
less than
ITP,
20,000. Less than 20.
pay attention, in ITP prohibited platelet injection.
Yes.
Why?
In ITV, we have less than 30,000. Why?
The treatment was IVIG. Why we didn't infuse platelet, Taha? Ask question.
Doctor, because the immune system actually attack to
Taha is explaining in Arabic why we didn't infuse platelet for ITP patients.
The body will have defensive deficiency.
We have something in tea. It's by enhancing to the bone marrow
cause of ITP was,
And
the cause of ITP was,
unknown.
cause.
It's unknown.
What happened in ITP?
and ITP is blood clotting. Followed by the immune system.
Okay,
Yeah.
autoimmune disease.
Yes.
You have autoantibody against platelet.
Yes.
I inject you platelet. What happens?
The body
What
resistance.
autoantibody?
The body
Decrease more, and activate about platelet.
So what's happening?
So repeat it.
What's happening if we have less than 20,000?
Okay, by Corton and IVIG, you increase immunity and the platelet goes up. Pay attention. This is question in the exam. What difference between ITP and Henoch-Schwann? Okay? Yes, also in Henoch. But in Henoch, effect on vascular.
She said the prognosis of...
Okay, prognosis good. Good. Also, sensitive. Both of them are sensitive.
But one has bad prognosis, one has...
No, all of them are good prognosis. These complications rare, but maybe happen. For example, bleeding is the brain is rare, but maybe happen. Okay? Do you have any question? Thank you so much and goodbye. Henoch-Schwann line, ITP.